patient come in, instead, I mean, probably 95% of primary care physicians or physicians in general would prescribe a medication and send them on the way. And, within the 7-minute office visit window, you're done, and you bill it in the EHR, and they get their drug and they go on. When really there's things in their environment or their diet or their lifestyle that are not very hard to fix, that are causing 50%, 70%, 100% of their asthma. And the medical establishment is kind of papering over that and treating the symptom forever. They're going to be on this drug as long as that's going on in the environment, as opposed to a simple fix of you shouldn't eat this, this thing that you're sort of, isn't treating you well. Is that what you're saying?
Yeah, and I'll give you a case example. So I had a young boy, 12 years old, came to me from an outlying clinic about an hour away, never seen the patient before. Mom comes in, says, I've heard you do this stuff. Can you help me? Child had been admitted on average 2 to 3 times a winter. So whatever that cost comes out to, it's 15.
Admitted to the hospital.
Admitted to the hospital, right? So expensive. Plus, not even to discount the fact that he's on IV steroids, IV drugs, heavy burden to the body. So I looked at him and said, it was about an hour visit again, sat down, talked to him, went through the environment, went through the history of his diet, and then drew some labs, frankly, and looked at micronutrient status. Was he low in zinc and vitamin D? Did he have some potential immune-related reactions to food? And it turned out he did. It turned out he was significantly reactive to 2 foods, dairy and egg. We looked at his micronutrients, found out he was low in zinc, low in vitamin D, low in iron. We basically just said, all right, let's talk about anti-inflammatory diet, which essentially is a diet very akin to the Mediterranean diet. We discussed changing up refined processed foods, get them out, get rid of certain things, eliminate dairy and egg, and then started some micronutrients, put them on vitamin D and zinc, and then said, hey, stay on your meds for now, right? Let's see how you do. So a year goes by. He doesn't get admitted once. He's now coming back for his follow-up at 3-month intervals. By the 4th follow-up, he's essentially asymptomatic. So now we're talking about downplaying his medicine needs. So
let's taper him off, or let's do a little bit less. Yeah.
Fast forward now, he's 4 years out, not on any medicines, has albuterol as a backup for if he plays sports, and he feels perfect.